what are some indications or scenarios you guys think that you might run into where a surgical airway would be indicated?
Facial trauma.
Yeah, exactly. So big one, facial trauma, facial burn is a good one. What about like a medical reason that might even be a little more common?
Allergic reaction.
Exactly. Some type of allergic reaction or angioedema situation where all of a sudden you show up, patient's short of breath, and their tongue is literally, you ever seen a true angioedema? Where their tongue is literally herniating out of their mouth? That should get your butthole going, oh shit, right? Because this is a big problem. Okay, so for us, we have our EM colleagues and anesthesia and us as trauma acute care surgeons that would literally all come to the bedside if that were to roll in the door. Now, we have a lot of resources. We can try to do a nasotracheal intubation on a bronchoscope, which works well. The airway is out, right, because of this. Or the end of the line is going to be this. So same in the field. If this is totally destroyed and that patient is hypoxic and progressing towards, a cardiac arrest due to an airway issue, you have to move to the surgical airway. So we flipped our little piggies around to be in your guys' perspective. My first question is, how are you going to make your incision? Are you going to make a horizontal or a vertical incision? Yeah.
Vertical first.
Yeah, exactly. So big proponent as a surgeon of a vertical skin incision, okay? It is going to give you the freedom to move up and down if need be. And don't be bashful when you make this incision. It's not a cosmetic procedure. It's a life-saving, heroic Hail Mary, right, to try to save this person's life. So make a nice, healthy incision. There's, aside from the great vessels, which obviously run more laterally, your carotid, your IJ, which definitely shouldn't be anywhere near those, but there's other small veins that are more lateral on the neck. Again, staying vertical keeps it cleaner too from a bleeding perspective. So 2 advantages to a vertical skin incision. Once you make your skin incision, you're going to try to pop into the trachea, and your kits come with a hemostat. And this is like one of our real nice, blunt dissecting tools that we use all the time. So you're going to bluntly dissect those tissues both horizontally and vertically, get into that airway, and then use these are the Cric tubes that come in the kit. They have this nice obturator, so it's going to keep a nice blunt transition as you put this into the airway, okay? And then the number one test question for a regular old orotracheal tube or a Cric, how do I know that this thing's where it's supposed to be?
Capnography?
Exactly. That is the answer 100% of the time. You're going to do all the other stuff. You're going to check for chest rise. You're going to listen for breath sounds. You're going to do color change. You're going to do all that stuff.